Okay, good evening, everyone. I would like to thank you for joining us tonight for a discussion about COVID-19, social determinants of health, and human trafficking. Tonight, your presenters would be myself, Dr. Celia McIntosh. I'm the current president of the Rochester Regional Coalition Against Human Trafficking, and Melanie Blow, who is the CCO of the Stop Abuse Campaign and one of the founding members of RRCAHT. So the Rochester Regional Coalition Against Human Trafficking, we, like I said before, would like to thank you for joining us tonight. The webinar is brought to you by RRCAHT. We are dedicated to eradicating human trafficking in our communities through education, advocacy, and networking with individuals. Some of our highlights this year include having our second annual fundraiser, hosting our first roundtable discussion about legislation to decriminalize prostitution in New York State, to better educate elected officials. We've also educated over 1,000 healthcare providers in the community, focused on increasing awareness around the issues of human trafficking. And we've also received a grant to do our first inaugural Human Trafficking and Social Justice Conference that got put to rest this year because of COVID-19. So I encourage you to visit our website. It is rrcaht.org for more information. RRCAHT has been in this Rochester community for 7 years now, doing education, advocacy work for individuals that have become victims of trafficking. So once again, thank you for coming tonight. So just some housekeeping. Basically tonight through the Zoom webinar, it will be recorded. We will have a question and answer session at the end of the presentation. All your lines are muted, and if you have any questions, put them in the Q&A section. Okay, thank you. And we will do our best to get to all the questions. So our first presenter is Melanie Blow. She is the Chief Operating Officer for the Stop Abuse Campaign. It's a national organization that prevents adverse childhood experiences through public education and public policy. As a member of RRCAHT's board, she has used her experience to help Rochester Regional Coalition Against Human Trafficking manage its media and communication goals. Melanie is all things legislation when it comes to RRCAHT. Melanie also sits on the Trauma-Informed Community Initiative of Western New York, the Downstate Crime Victims Coalition, the only member west of the Hudson, and is a member of the Public Policy Committee of the Associate of Professionals Against Child Abuse. So thank you, Melanie. I am a board certified family nurse practitioner and psych mental health practitioner as well. Received my doctorate and master's at St. John Fisher College. Attended Brockport for my bachelor's, MCC for my associates. I am currently a full-time nurse practitioner working in neurology. Interests vary from public policy advocacy to educating about human trafficking. Joined the coalition in 2014 after hearing about human trafficking for the very first time while at RGH. I was walking into work. The coalition had a table out and they started telling me about human trafficking. And I was in awe. And at that moment, I had been a nurse for about 11 years. And I figured if I knew nothing about human trafficking, there were a lot of my colleagues that did not. So I have been the president of the coalition since 2016, and just really passionate about social change and health policy. So thank you again. So our major objectives tonight is really to give you an overview of what human trafficking is in relation to the context of social determinants of health and how it relates to human trafficking, and really to discuss human trafficking and what the impact has really been surrounding COVID-19 and the pandemic. In addition to that, really giving you some organizational strategies to kind of assist, clients and patients, or just individuals that are being trafficked that you may interact with during this time. So without further ado, I am going to turn it over to Melanie Blow.
Thank you so much, Celia. I appreciate that. So let's start by defining human trafficking. Next slide. There we go. So human trafficking is a term we hear a lot, and the precise meaning gets lost sometimes. So from a legal point of view, sex trafficking is defined as when force, fraud, or coercion is used for a commercial sex act, meaning money changes hands, or when a minor is used for commercial sex, even if there is no force, fraud, or coercion. Minors are not allowed to work full-time. Minors are not allowed to have sex with adults. So it makes perfect sense from a legal point of view that that piece is removed from it. So any sexual access to a minor in which money changes hands is human trafficking. When you're talking about adults, it's a little bit more complicated. We have to document the force, fraud, or coercion. For labor trafficking, the federal definition is the recruitment, harboring, provision, or obtaining of a person for labor services through force, fraud, or coercion for the purpose of involuntary servitude, peonage, debt bondage, or slavery. So basically, force, fraud, or coercion for some other kind of work. With adults, it's that force, fraud, or coercion is the most important defining characteristic. Next slide, please. Okay, so there are three categories, very broadly speaking. There are three categories of human trafficking victims. Minors involved in commercial sex, adults in commercial sex, and again, they have to meet the force, fraud, or coercion standard, or adults who are being, through force, fraud, or coercion, are performing some other kind of labor. That can mean a lot of things. That can mean tasks that are in general legal in the United States, like farm work, like working at state fairs, like working in restaurants or the hospitality industry. It can also mean things that are not generally legal in the United States, such as drug dealing. It's a huge, huge umbrella, but the point of today is not really to dwell on all of that. Okay, so next slide. So again, since trafficking is a little bit of a complex issue, there's complex pieces to it. There has to be a process to recruit, to harbor, to move, or to obtain trafficking victims. There is a means in which force, fraud, or coercion, or if we're talking about minors, their own inherent vulnerability in this world. And the end, which is involuntary servitude of some description, whether that's in legal labor, illegal labor, or commercial sex. Okay, next slide. So it's very important to remember trafficking is a long-term relationship-based crime. It is, like we just saw on the last slide, there's a lot of steps to making somebody into a trafficking victim. Trafficking victims are going to have some kind of a relationship with their trafficker. If we're talking about commercial sex, very often they have a relationship of intense emotion and intense dependency with the person who is trafficking them. When we're talking about labor, very often it's more of a fear-based relationship. You have somebody who is in control of somebody's paperwork, who is control of somebody's identity, control of somebody's means of transportation, means of contacting with the outside world. who is in control of this person. But it's a relationship. People do not consent to being trafficked, by its very definition. People may consent to some act that leads them down this path. People do not consent to being trafficked. And it is a crime against an individual. As opposed to smuggling, which we often is a term that's used synonymously, but that's not correct, which is a crime against the state and is a one-time situational event. Another thing it's worth mentioning, trafficking does not necessarily involve moving people from place to place. It very often does, but it doesn't need to happen. All that needs to happen is that one human being has complete control over another and is making that person perform work and earn money. Okay, next slide. Okay, so human trafficking, it sounds really bad, and it is, and it's not something any individual wants to experience, and it's not something anyone wants anyone of their loved ones to experience. And it's very easy to think of it that way, and to think of it as this horrible, shocking thing. It's much more practical and much more solution-based and much more useful to think of it as a public health problem, because all of us play a role in public health, as you know, we've learned in spades this year. And as we've learned in spades this year, there are a lot of different pieces to what even constitutes public health. When it comes to pandemics, when it comes to trafficking, when it comes to all sorts of things. So with understanding human trafficking, it's very important that we understand societal risk factors. You know, the big things that go wrong in an entire nation that increase people's risks. Certain other things, specific things can go wrong or right in a community that increase or decrease somebody's risk. Certain things can go wrong or right in a family, in an intimate partner relationship, in a parent-child relationship that increase or decrease risk. And there are certain things with individuals that can increase or decrease their risk. Okay, next slide, please. Okay, so child sex abuse versus child sex trafficking. We're getting to a point now where people are using these two terms almost interchangeably, and that's very problematic. They are related, but they're very related, but they're very different crimes. Trafficking always involves money trading hands. If money is not trading hands, it is not trafficking. Most child sexual abuse is not commercial. Most child sexual abuse, a predator gains access to a child based on their own relationship to that child. Sometimes other adults facilitate that, and that's a very unfortunate situation. But if money or anything of value, such as drugs, rent, etc., if no money, nothing of value is trading hands, it is still not trafficking. Trafficking has to involve that money, that commodification. It is important to remember that most sexual abuse does not fall into this category, even if there is a lot of organization, even if there is a lot of planning, even if there is some sort of a middleman. There is not, if money or goods of value are not trading hands, it's not trafficking. Child sex trafficking represents a very small part of child sex abuse. That's also a very important thing to remember, especially as these terms are being muddied so commonly now. Okay, next slide. On a micro level, the relationship between a trafficker and a trafficking victim bears an awful lot of resemblance to domestic violence. And that's a very useful way to look at it. So you will have typically a lot of physical brutality, a lot of emotional brutality. You will also have a lot of people of good stuff. You will have a lot of, a lot of closeness. A lot of abusers are smart enough in manipulating other human beings that they can manipulate they will make their victim afraid of them and then immediately calm them down, immediately apologize, say, I wouldn't have done this if you hadn't made me, etc., etc. They also are very good at emphasizing their role in protecting the victim from other stuff, which, to be fair, there is, sex work is very dangerous. Coerced drug dealing is very dangerous. Even with a lot of labor trafficking, sometimes these people are in very risky situations, especially if they fear deportation or arrest. So the trafficker is playing this very significant and very complex role in the life of their victim. And it's very important to remember that. We have this perception that victims, at the first opportunity, they are going to run away and run to the welcoming arms of a rescuer and never look back. And that is not realistic. That is simply not how it works. Yeah, and the final note, it is important to note that physical force does not need to be present for trafficking. And that is absolutely true. Sometimes things that can keep a victim from leaving a very, very dangerous, unpleasant situation are fear of arrest, fear of deportation, fear that they're going to lose access to a illegal drug that they depend on. Drug addiction and trafficking, we're going to touch on that a couple more times, but drug addicts are very vulnerable. The term chemical coercion is used sometimes to describe that. If you get somebody addicted to a drug or find somebody who is already addicted, they're a whole lot easier to control. They're a whole lot more vulnerable. And, their dependency on that drug is one more thing that gets them stuck in this situation that nobody really wants to be stuck in. Okay, next slide. So, like we already said, trafficking is a mixture of control, very often brutality, and very often illegal stuff going on. So those are typically combinations of that are things you typically see in victims and are typically helpful in identifying victims. So this is a very short list for a very complex issue, but just some things to always be mindful of. Significant red flags. If somebody is not allowed to leave a working environment, is not allowed to leave, that's not good. If somebody said they're not allowed to leave their place of employment or even someplace where they're living, if somebody expresses that they're simply not allowed to leave, that's not good. If somebody else holds their ID, their passport, their driver's license, anything like that. Also not good. That while moving people from place to place is not a requisite for trafficking, it is a very common tool for labor trafficking and for sex trafficking, because it makes it harder for police to find somebody. It makes it harder for victims to form connections with any possible source of help. So if you encounter somebody who does not know where they are, who does not know what city they're in, does not know what state they're in, somebody genuine, you are in an emergency room, you ask somebody, do you know where you are? And you're in Rochester, and they say, oh, I'm in Chicago today. That's not normal. That is something you would view as a red flag. Somebody who is always working, somebody who is, a large chunk of their time is preoccupied by work, but they have no money. We all feel like this sometimes, but when that's literally the case, or if somebody is not allowed to be in possession of their own money, that's a red flag. Someone who shows excessive fear of a particular person, of a particular situation, again, a red flag. A minor providing commercial sex that's not even a red flag. That is by definition trafficking. When you see somebody who is presenting with signs of physical abuse, malnourishment, or significantly denied health care, it can be a sign of trafficking. It can be a sign of other things too, but they're all bad things. They're all things worthy of, somebody's attention and outreach. Or again, if somebody's story about an injury or an illness is incredibly inconsistent, or just does not make any sense. One that I heard about from an ER nurse was somebody who had the imprint of a gun on their face, and they said, oh, I fell. You ask a couple more times, and they're talk about falling on this, that, or the other thing in the house, but not onto a gun. So, a story that just absolutely does not make sense or is not consistent. Somebody who is very afraid you ask them, how did you get hurt, or why are you here? And just afraid to answer anything at all. That's also that's not a good sign. That's definitely a red flag. Common traits of trafficking sites. Next slide. Okay. Drug use. We talked, as I touched on earlier, drugs are a means both for traffickers to control victims. It's also a vulnerability that sometimes puts victims in contact with traffickers. And it can be just a source of, traffickers provide their victims with something to make them a little quieter and less likely to cause a fuss. Massive health and safety violations, overcrowding, especially when you're talking about labor trafficking. When they do find a labor trafficking site, horrific overcrowding is a very common thing that will be observed. People sleeping on floors, and people just being packed in there, sleeping on floors. Workers who are reluctant to talk to visitors or anybody else. Fear, disorientation, signs of physical injury. One person who will do all the talking, who will not let who insists on being the one to speak to the doctor, speak to the social worker, speak to whoever it is who is there. Not letting people talk directly to the person who's asking the questions. And yeah, sometimes the presence of of women, presence of children who just seem incredibly out of place, or say they're just, they're just visiting, they're unaccompanied. Okay.
So when we talk about human trafficking and how, thank you, Melanie, and how that's the COVID-19 is playing into this, we already know that, human trafficking impacts individual health. And we know that victims are often, experiencing traumatic injuries, whether that's a broken bone, whether that's burns, whether that's infections, sexually transmitted diseases such as HIV or STDs, or even unwanted pregnancies. One of the major things that we often see is, malnutrition. Victims of trafficking, labor trafficking more specifically, often have exposures to different toxins. One of the other big red flags that we often see is, PTSD and depression. Human trafficking, in a sense, causes this disintegration, this, discrimination. There's some community bias. Maybe there's even some societal expectations of cheaper consumer goods. When this whole thing came out with the PPE, it was kind of like a mass rush trying to get supplies for nursing in different organizations. So, and we've seen supplies from companies that we've never seen before outside of the United States. So there's this big demand for cheaper consumer goods, even within the hospital. So we know that, there's been an uptick with labor trafficking, and there's oftentimes an uptick with sex trafficking, because things tend to be more hidden. It's hidden anyway, it's always in plain sight, but even more so with the pandemic and with social isolation. So these are many of the reasons why human trafficking is such a public health problem. So some of the societal impacts, COVID-19 has created a lot of social change. When we talk about social distancing, many organizations where victims used to go and get resources, many of them have been closed down. They've closed their doors. Victims are not able to go in and engage with the social workers, case managers, a lot of the staff like they used to before. So even here, when Melanie talked about domestic violence and child abuse, we've heard that there's been an uptick in those specific areas of abuse. And we know that even here in our Willow domestic violence shelter, they've had a 40% increase in calls since this whole pandemic started. So shelters also have been a problem. We know that there's been a lot of increased economical strain due to the social distancing efforts, and it really creates this increased risk. So where are many of your youth or victims that are homeless? Where are they going? What are some of the protocols in the shelters? Are there are there even any rooms? So that's been a major problem of, really trying to have access to services for these victims. One of the major things that we've been hearing a lot in the community, when we talk about schools being closed and business being closed, schools used to be one of those points of engagement, or those where victims would go. Like, for example, maybe the teacher picked up on some of the abuse or some of these red flags that Melanie spoke about earlier. And they would essentially, refer them to counselors or refer them to child protective services, or maybe, or other patient offices or organizations like Center for Youth. And what we know is that there's been a downtick. There's not a lot of those referrals anymore because there's not that face-to-face interaction. So we know that even though there's been a decrease in referrals to these agencies, that doesn't necessarily mean that there's been a decrease in the actual trafficking. We know that, a lot of events and meetings have been canceled, so that decreases the networking, the communication with different organizations. Expanding, there's been a lot of online communication. So, that begs the question, has there been an uptick in social media, essentially traffickers trying to access individuals through social media because there's an increased online presence now. We know that we've heard that pornography is now increased because of a lot of the online communication. Like I mentioned before, the unemployment, the poverty. Rochester used to be had the fifth highest poverty rate, and a few years ago it was the third. So when you combine, the poverty and you combine the unemployment with people having to be out of jobs if they're non-essential, that increases someone's vulnerability to be trafficked during this COVID-19 pandemic. And then, of course, the increase in homelessness, especially from the economical strain. So all that increases the vulnerability. We know that this is just a slide to just have you think about this, that human trafficking, it has a lot of intersectionality. So when you talk about race, ethnicity, when you talk about language barriers, when you talk about being an immigrant or migrant worker, your culture, all these different things increase your vulnerability, and they overlap. So coming to our point of how are social determinants, like why does social determinants matter and how are they impacted by human trafficking, or how essentially we know that trafficking, like healthcare disparities, they target marginalized groups. The equation of human trafficking involves three different types of participants: people who are vulnerable, people who arrange and profit from the trafficking, and people who are customers. We know that the COVID-19 pandemic is generally generating new vulnerabilities to be exploited, and we know that there's new strategies for recruitment or marketing of victims. And we also know that there's a higher risk of COVID-19. So essentially, human trafficking, there's a much bigger problem than traffickers. If you have underlying social determinants of health, like if you are living in poverty, if you are discriminated against and you don't get the appropriate care that you're supposed to get, then you're at increased risk for getting, COVID-19, and therefore your risk just is more heightened. When we talk about social justice issues, that just adds another layer, because we know that victims of trafficking are usually in the criminal justice system, whether it's been through juvenile justice or through foster care. So that adds another layer. And when we talk about the environmental factors, the pandemic essentially is essentially in a natural disaster. When you talk about community segregation, when you talk about some of those social barriers, those all play into this. And then, of course, when we're talking about things like education, we've heard that there's, with the decreased engagement in educational systems, we've talked about that it increases, the perpetuatory, the pornography and the online communication, but it also the increased risk of child abuse, the increased risk of domestic abuse. And when we talk about mental health issues, the social isolation has also been exacerbating some of these risks of mental health issues. So many people are, living in fear, or they have uncertainty of what's going to happen next. So that's increasing, the depression, the anxiety, overall, just the fear of the unknown. So just to expand on this a little bit, when we talk about, how is human trafficking affected by the COVID-19 pandemic, we talked about poverty, unemployment. In Rochester here, we're facing a lot of food deserts. If the bus wasn't running because we were trying to mitigate exposure of the COVID-19, then there was lack of access to transportation. Poor, when you listening to all the, different news media talking about the Rochester City schools, when you talk about the education and how unstable that is, and even housing during this time, a lot of people are conflicted because, and there was, just trying to even get the governor not to evict people during this time, because of course, with unstable housing increases homelessness, that creates a bigger problem for people, increases their vulnerability. So we know that human trafficking victims, like I said, likely experience homelessness, and homelessness is independently associated with COVID-19. Limitations in social distancing, difficulty with getting access into the shelters creates many problems. When we talk about the healthcare disparities, especially in the hospital organizations, COVID-19 has taken a priority over many of the different protocols that were being built. Even in our organizations, we've had to really try to keep the focus on developing this protocol because we've been pulled in many different directions trying to develop things for COVID. So many of the providers are pretty much preoccupied with, getting things in place for the coronavirus, and oftentimes you're not able to assess the patients for those kind of subtle red flags that you may pay attention to more if you were in a different climate and you weren't really focused on, getting in your PPE and focus on screening people. Your priorities would be different. We talked about, child abuse and trauma. Child abuse, we know, increases. That has increased, but like I mentioned before, the referrals to CPS has decreased because there's a limit in the face-to-face and from the children at school. A lot of, when we're talking about discrimination, there's a lot of different systemic policies when we talk about racism that are in place that increases, just the discrimination essentially. So that increases the victimization. And especially in this climate now where, there's a big push for police reform and police brutality and just that injustice that's another layer on top of not having the correct resources. It's a spiral, it's a big cycle. So when we're talking about mental illness, the demand has increased for services. As a mental health provider myself, people have limited access in terms of, okay, you can't come into the office because of the pandemic and the 6 feet rules and all the precautions we have in place for that. Some people do not have, the right capability to have telemedicine. So that's been problematic. So they're not able to see their providers. Then you have to, many organizations are not taking Medicaid or Medicare, their private pay. And if people are out of work because of the economical strain, then they're not getting the services that they need to get. So there has been increased drug use. So there's an increased risk for overdoses during this time. So just a lot of, like I said before, PTSD, depression, anxiety. So there's definitely been an increased demand for mental health services. Okay. So when we talk about trafficking and pathogens and kind of like just wrapping that up, when Melanie talked about, that these different common sites of where trafficking victims live, trafficking victims are often forced into the substandard housing. So when you have the substandard housing, then you have increased risk for communicable diseases, whether that's bed bugs, whether that's the COVID-19 pandemic, because it's, in close proximity, there's the risk of being infected with that. Definitely unsafe conditions, them not having a proper PPE if you're working in, whether it's a farm, whether you're on a farm or working in a manufacturing site. If you don't have the correct equipment, then you're definitely at greater risk. And then, of course, like I said, little access to healthcare. There are a lot of patients that are just not coming into the hospital because they don't want to get COVID-19, because if they do, then their employer, especially if they're on a visa, specifically labor trafficking, if they get sick, they're not going to want them to work. So then they lose that income and can't take care of their families back home. So that's another layer. And then, of course, co-occurring mental health issues with the substance abuse that makes it difficult to fight off the disease. Your immune system is broken down. So that just adds another layer. And of course, those with the least control over their life have the least control over their health and are hit harder by these infections.
Okay, thank you so much. So how has this pandemic, what else has this done what has this done for trafficking victims in our community right now? And since trafficking has so many causes, this is such a complex situation, a lot of little things have rippled, and a lot of little things in the community have had an impact on the state of trafficking victims in the community right now. One of the first things that happened was courts got closed, and this includes the diversionary courts, which New York has a lot of, and this community has a lot of. Specifically, we have a human trafficking court, we have a drug court, we have a mental health court, where if for each of those things, if it is determined that the reason the person has been arrested is primarily because they are a trafficking victim, primarily because they have an underlying addiction, or primarily because they have an underlying mental health condition, they are given, these diversionary courts give them the opportunity to have convictions expunged if they do certain things designed to fix the root cause of whatever it is that's bringing them in there. For human trafficking courts, that is usually to get an STD check, to go to a support group, to work with a caseworker, to try to get housing, to try to get income, to try to get their identity restored, because you can't get income or housing if you cannot present proper identification to DSS. So these courts have a pretty good track record. These courts make it easier for people to re-engage in society and re-engage in employment once they've completed what they're supposed to do, and once they get that arrest expunged. And they're also good for the people who are in it, because it really provides them with a lot of motivation to make the appointments, to do what they are supposed to do to get their lives in a better place. So the courts themselves were closed for a very long time, and that's just threw a monkey wrench into things. And a lot of the services that victims have been relying on were no longer available, or were much less available. As Celia mentioned, telemedicine is hard. It's harder to build relationships with it. Trafficking victims have a very significant trauma history, usually before they get trafficked, and certainly after they get trafficked. And trust, one of the most important factors in helping people with trauma histories, being able to form a trusting relationship. It's harder to do that when you are looking at a little box of somebody the size of a postage stamp on a phone. It's a lot harder and trauma victims also tend to be very good, even without realizing it, at reading body language. Not having body language to read makes the process a little bit harder for them. So telemedicine, it's got some advantages, and it certainly is better than nothing during the pandemic, but it's a step down from what victims in the community used to have access to. Also, you need a phone, and if somebody's trying to control you, that phone can disappear, and that's another whole weakness with it. There have been, even though homeless shelters were allowed to operate throughout the pandemic, and people who work directly with impoverished people were allowed to keep doing what they do, there were huge concerns over liability and just over what's the morally appropriate thing to do. People are not comfortable exposing staff and volunteers to a serious infectious disease. So a lot of outreach has been suspended, and a lot of sheltering has been suspended or reduced. Also, there were a lot of issues with homeless people who simply felt it was safer to try their luck someplace, any place, other than a shelter, because they see the news too. They knew what was going on too, and it's scary. Homeless shelters are, in normal years, they're considered to be high risk sites for tuberculosis and other things like that. So the shelter capacity was reduced, and a lot of people chose not to use them. Since there has been so much unemployment and so much reduction in income, we've had a great increase in the use of food banks, people's reliance on food banks, people's reliance on even things like thrift stores to get clothes and household goods and stuff like that. So now all of a sudden, a resource that had been able to serve a population pretty well just got tapped out, leaving everybody with a lot less access to food. And healthcare became harder because of the reliance on telemedicine, because of the reliance on having to make appointments and wait, and not being able to just show up at an urgent care clinic if there's too many people in there. All of these logistical things have made it, for the most vulnerable people, has really made it into a big issue of genuinely limiting their access to things that are helpful. Next slide. So human trafficking is caused by a lot of things, and it impacts public health in a lot of ways, as we've all seen. So when you talk about what are the things we need to do right now, probably the single most important one is we need to elevate issues concerning child welfare, economic justice, and social justice to the level of public health emergencies, because they are. Okay, and let's look at a few more detailed, some little details about that. So, other than change the world, what are some things we can all do to help trafficking and high-risk individuals? We need to keep assessing people. If anyone has any questions about how things to look for, if anyone wants more information about tools to use to assess or anything like that, you can connect with RRCAHT after this. There's a lot of information out there. It doesn't do any good if people don't use it. Pandemic or no pandemic, we got to use it. We need to be very mindful at all times of the social determinants of health in trafficking victims and potential trafficking victims and anybody else. We need to be able to connect individuals with resources they need. That's a little more complicated now that some of those resources are reduced, some of them are gone. It's our responsibility as people in helping professions to understand what's around and how to make it work as best we can. We need to spread the word. We need to keep educating, helping people in helping professions about how to spot these individuals, how to help them. And we need to keep working on better, health system protocols. How can we better spot individuals who are being trafficked, individuals who are at high risk, and how can we better intervene to help them? Okay, next slide. So some things we can do are expand digital engagement. I think that's been a challenge for just about every human being with a cell phone in the last 6 months. We, as a nation, have gone from not knowing what Zoom was to getting pretty good at it. We've learned to work the software. Now we need to do is work the human experience into it. We need to do what we can to recognize that, yes, if your only way to connect with people is through telemedicine or through some virtual appointment, well, if that's what we've got, that's what we've got. We've got to get comfortable about it. We've got to learn to capitalize on the strengths we have for it. We always need to evaluate clients for their needs and vulnerabilities. We still need to be able to do safety planning for victims, for families, for people at high risk. We need, and again, some of that's changed with reduced availability of services, but it's our job to stay current on that. Have transition plans, like as always, and be mindful of the trauma these individuals have experienced in the past, be mindful of the trauma they're experiencing now, and work, do everything within our power to keep pushing forward, to keep building that relationship, to keep building that trust. It is a scary time right now for everybody, and getting, trust is one of the most important things. Healthy relationships that contain trust are one of the most important things. So I guess I'd like to open it up for questions now. Okay.
There's some questions in the Q&A.
Okay, I'm going to. Okay, let's see if I can. Oh, I just saw. Okay, I see. Okay, I see. Are you anticipating the dollars to address human trafficking will decrease with the economic crisis? Okay. Yeah, so in addition to everything, the economic crisis that individuals are going through, New York State is obviously in a very bad place right now. New York State was going to be in a bad place financially before the pandemic. The pandemic did not make anything better. So yes, I do expect there is going to be a decrease in funds. Human trafficking is it's such a high profile issue. I doubt anyone is going to specifically say that this is what they're doing. But I suspect it's going to be death by 1,000 paper cuts. And I suspect that a bunch of the little services that that victims depend on are going to get cut. And yes, I'm expecting the next couple of years are going to be ugly. That's just my guess. But yes, that is what I'm guessing.
So just not a question, but Greg shared this document with us, which is really good, because a couple years ago, when there was the public health law that came out, 2805, requiring different organizations to have policies, procedures, and protocols in place to screen and connect victims of trafficking to services. I wasn't aware of this document. So I'm glad to see this here. And it basically talks about the New York State Office of Child and Family Services, that the governing bodies of all New York State Child Protective Services say this, that children meet the federal definition of child sex trafficking victims if they have one or more of these indicators. And these indicators include child reports in engaging in commercial sex act, child reports he/she has been prostituted or trafficked, there are photos or videos of the child being victimized and or being used to advertise the child for sexual purposes, and law enforcement refers child instead of arresting for prostitution or does arrest for prostitution. Child reports trading sex for place to stay, food, drugs, or anything of value, as Melanie mentioned. Someone witnesses the child engage in a sexual act, and youth over 18 is engaging in prostitution or commercial sex acts due to force, fraud, or coercion. So thanks, Greg.
Yep.
Any other questions? We do have time left. Okay. Okay, let's see if there's any more, and if not, okay. Okay, so I don't see any more questions. So I want to thank you again for joining us tonight for a discussion about COVID-19, social determinants of health and human trafficking. We hope this PowerPoint webinar was helpful to you. Like I said, we encourage you to check our website. We are on, we're on Facebook, we're on Twitter, we're going to be on YouTube. This will be posted on YouTube in a couple days. This webinar is brought to you by the Rochester Regional Coalition Against Human Trafficking. We're dedicated to eradicating human trafficking in our communities through education, advocacy, and networking with individuals. And like I said before, we really encourage you to check out our website. We're always looking for new members. So anyone that's willing to advance our mission in the work that we're currently doing. So thank you for coming tonight. I see there's a few more questions. Let's see here. Okay. Do you guys plan on having any person trainings next year after COVID-19? Yes, we had received a grant to put on our first conference. It's going to be a combined human trafficking and social justice conference. The plan is to have it in May 2021, but we have to figure out, what the colleges are going to do, because we still plan on having it at St. John Fisher College. So yes, we intend to have it, but like I said, depending on if we're going to get a second wave of the COVID-19, if there's going to be an uptick in it, that may change our plans. But yes, we do.
So in other words, it's as certain as anything else in the world right now.
Yes, but we're going to try to continue doing some of these webinars. If there's any specific topic that you would like us to discuss or us to elaborate on, just email us. Like I said, go to our website, send us a message, and we'll try to make that happen for everyone. Okay, so if there's no more questions, I want to thank you all again for attending our webinar. We really appreciate you. Have a good night.
Yep. Stay safe, everybody.